Hello, my name is Enos and welcome back to the channel. This is Work and Wonder. On this channel, we talk a lot about the mental health nursing OSCE. I have a lot of videos on my channel. So if you are someone or a candidate who is preparing for his or her mental health nursing OSCE, you might want to check the channel out and then look at the various videos that I have posted on the various stations. So for a very long time, a lot of people have been asking for a video on the evidence-based practice, and today I will be talking about the evidence-based practice. So first of all, I will tell you what the evidence-based practice is all about, and then we would also be looking at one of the topics. We'll pick one of the topics, we'll look at the scenario, we'll look at the article, we'll look at the marking criteria, and then we'll also look at a sample answer to this particular topic. So that is what we'll be doing, and then I'll try as much as possible to make it very simple for you to be able to understand it. So first of all, the evidence-based practice is one of the silent stations in the mental health nursing OSCE. The evidence-based practice and the professional values, they are the same whether you are doing adult nursing, whether you are doing you are doing mental health, all across all the pathways. It's the same thing. So evidence-based practice and then professional values is the same for all the pathways. Now, the evidence-based practice is 10 minutes and it's a silent station. So what it means is that you don't have to demonstrate anything for the examiner or the assessor to see. You just sit there, they give you the scenario, they give you your answer booklet, and then you write out your answers, and then at the end of the time frame, which is 10 minutes, you present your answers to the examiner, and based on your answers, the examiner is going to mark to determine whether you have passed or you have failed. With evidence-based practice, it is very important that you know your marking criteria. The marking criteria is the key thing here. Knowing it is the key thing here. Once you know your marking criteria, it will be as simple as anything for you to be able to write out your answers. So what is the evidence-based all about? The evidence-based practice is all about the fact that everything that we do as nurses, there should be some form of evidence to it. So if I'm doing something on the ward for the patient, I'm not just doing it because I feel like doing it, but I'm doing it because there is some form of evidence to it. So for example, if in hospital A, a patient is in pain and then I'm administering paracetamol for the pain. If I go to work in hospital B or hospital C, I should still be able to give any patient there who is also experiencing pain paracetamol, because paracetamol has been found to be an analgesic, which is good for pain. So there is that evidence that suggests that it is a pain relief and then it can be given in such circumstances. So you can see anything we are doing, there is some form of evidence to it. And what the NMC has done is that they have given us a list of topics, and under these topics you'll be examined on one of them. So today we'll be looking at something like the ankle sprain, and any of the topics that they give you, first of all there is a scenario, and then there is an article. Then based on these two, you write out your answers. The scenario is always that you are in a position where someone is asking you a question. So it could be the patient relative, it could be the patient himself or herself, it could be a student nurse, it could be another nurse, it could be a junior nurse, so you are always, the scenario puts it in such a way that you are always in a position where they are asking you a question. So for example, the ankle sprain that we'll be looking at as our example for today, you are a nurse and then the patient has gotten a sprain, and then the patient can ask you or will be asking you whether paracetamol or brufen is good for the pain management. It could be the patient themselves, it could be the patient relative, it could be another nurse. So always read the scenario and then understand it, and always pay attention to the scenario, because sometimes within the scenario there could be some very important information there, and that will be able to help you to write out your answer. So without wasting much time, we'll go straight into the ankle sprain example or topic that I said we'll be looking at. As you are seeing on your screen, this is how normally the question will come to you. So you see the topic ankle sprain, and then the overview, read the scenario and answer the summary of the research below. So this is the scenario. You are working on the trauma and orthopedic assessment unit. Mr. Z was admitted this morning following his scooter accident. He has a history of asthma Mr. Z is in pain due to his sprain, so he is prescribed paracetamol. Mr. Z is inquiring whether brufen would be more effective than paracetamol for him. So as you can see clearly here, Mr. Z, who has a sprain, is the one asking you the question. As I said, it could be the patient, it could be the patient relative, it could be another nurse, it could be a student. Here, it is the patient that is asking you this question. The patient has a sprain, and then the patient has been prescribed paracetamol. The patient is asking you whether brufen will be better to manage the pain as compared to that paracetamol that has been prescribed. And looking at the scenario, there was a very important information that was also in there. It stated that the Mr. Z is a known asthmatic. Mr. Z is a known asthmatic. So as you can see in the scenario, this is a very important information. And as we go to the bottom, you will see why. So this is a scenario that has been given. Now, this is the article that they will normally give you. There is always going to come with an article. Now, let's read the article together. A systematic review in a well-graded peer-reviewed journal investigated paracetamol and brufen among patients for their superiority. The review found that Study A case-control study, showed that paracetamol and brufen had similar effectiveness on pain. That's the first point. Then study B, a small survey found that 33% of clinicians choose to prescribe brufen even when there is no clear proof of superiority over other analgesia. So other doctors would prefer to prescribe the brufen, but there's no evidence to suggest that it's better than other analgesic. Then the study C says that a quasi-experiment study showed that patients who had soft tissue injuries reported effective analgesic relief with paracetamol. So this is also another vital information that the research came out with. Then the last one is, according to the brufen's package insert, you shouldn't take it if you have experienced asthma, urticaria, or allergic reaction after taking an NSAID. If you have asthma and are aspirin sensitive, using these products may cause severe bronchospasm, which can be life-threatening. Approximately 5% of people with asthma are sensitive to NSAIDs. Most are adults. So you can see this as the article that they have provided, and this article is supposed to help you to be able to give your answers to Mr. Z, who is asking you the question of whether brufen or paracetamol is good for the pain that they are experiencing as a result of their sprain. Now we'll go down and then we'll look at the marking criteria. Now this is the marking criteria. So the marking criteria, as you are seeing, summarizes the main findings from the article, summary, and draw conclusions, making recommendations for practice. And then I'll just skip to the 1B. Inform Mr. Z that both paracetamol and brufen are equally effective analgesics. Then explain to Mr. Z that some clinicians prefer to prescribe brufen, but there is no clear evidence that it is superior. Then D says that advise the current available research suggests that paracetamol is effective analgesia for pain resulting from soft tissue injuries. Then the 1E says that explain to Z, although brufen is safe, it can have more adverse effects and can be contraindicated in patients who have bronchospasms, cardiac, and then renal failure. Then the last one says that recognize that Z is asthmatic and advise that paracetamol would be more suitable. So you can see what is happening here. The reason why I love the evidence base so much is that the article will always remind you of the marking criteria. So if we look at the article, the points that we could draw from the article, it's reflecting this particular marking criteria, which makes it very, very, very easy. So even if you have forgotten some part of the marking criteria, just by reading your article, this should be able to remind you of your marking criteria. Now, how do you write your answers? The most important thing. The answers is just basically converting your marking criteria, personalizing them, and then that becomes your answer. It's as simple as that. So let's look at the answer. This is a sample answer that I've crafted. I will inform Mr. Z that both paracetamol and brufen are equally effective as pain relievers. So if you look at the point of the first article, it says that both paracetamol and brufen are good for pain. So that is exactly what you're going to tell Mr. Z who is asking. So I will inform Mr. Z that both paracetamol and brufen are equally effective as pain relievers. Then the second point will be that I will explain to Mr. Z that while some doctors may prefer to prescribe brufen, current evidence does not clearly show its superiority. So you can see it's just a repetition of the marking criteria. Then a third point to be, I will advise Mr. Z that existing research support the effectiveness of paracetamol in managing pain for soft tissues. This was also clearly stated in both the marking criteria and then the article says that paracetamol is good for soft tissue pain. Then I will explain to Mr. Z that although brufen is generally safe, studies indicate it may carry a higher risk of side effect and may be unsuitable for individuals with asthma. This was also clearly stated in the marking criteria as well as the article. Then the last point to be, I will inform Mr. Z that given his history of asthma, paracetamol will be more appropriate choice for pain relief in his case. So you can see how simple this is. A very simple answer which is linked to the marking criteria, and then the marking criteria which is also linked to the article that is provided. So this is very easy. They give you the article, they give you the scenario. All you just need to do is to read the article, which will essentially remind you of your marking criteria, and then you personalize them. I will explain, I will advise, I will explain, I will inform. These are some of the words that you can use. As you can see, these are the words or the choice of words that I use in giving the answers to Mr. Z who was asking the question about the paracetamol. So you see the trend. The main scenario is about someone that is asking you a question. They give you the article, and then your answer is a response that you are giving to the person that is asking you the question. All you just need to do is to inculcate the name of the person that is asking you the question, and it's just as simple as that. So this is your evidence-based practice for ankle sprain. This is how you write out your answers, and you are expected to do this within 10 minutes, which is, if you know your marking criteria, you attest to the fact that this is more than enough for you to be able to write out your answers. And that is a video for today. A lot of people have been asking for samples like this to be able to practice with it. In the description, you are going to find a link. I have the professional values and then the evidence-based practice booklet, which are scenarios on all the topics. So if you pick something like the evidence-based ankle sprain, I have a scenario on it like this. If you pick my cardiac infarction, I have a scenario, and all the scenarios comes with the articles so that you can use it to practice. So just go into the description, you find a link, and then just click on it, and then you can have access to it so that you'll be able to practice with it. In my next video, I'm going to pick one topic under the evidence base, and then we are going to go through it like this. We'll look at the marking criteria, and then we'll look at the article. We'll also look at the sample answers like this, and I'll be doing this for all the 11 topics. And at the end of the day, we'll have a lot of videos on the evidence-based practice. This has been the video for today. My name is Enos, and please make sure that you subscribe to the channel, and then anytime I upload videos like this, you'll be notified and you can come here and take a look at the video. My name is Enos, and until I see you again in my next video, it is a bye for now.